You have been told your pet needs to have a dentistry. What does that mean? What do I have to do? Where do I get that done? Is it safe? Please take a few moments to watch the following video to help you better understand where to go from here. Dentistry is a very common procedure we do in our surgery department each day. Many people, however, do not realize that your pet needs to be anesthetized for dentistry. It is the only way our staff can take the x-rays that are necessary for proper diagnosis. Unlike their human counterparts, our pets cannot understand this procedure, and without proper x-rays, a complete oral health assessment cannot be performed. If you thought keeping your pet still for a family photo for a few seconds was tough, you can imagine how difficult it would be for dentistry. While we can sit still in our dentist's chair, they cannot. Extracting the tooth of a dog or cat cannot be done without anesthesia or pain medication. If you have ever had a wisdom tooth or abscess, you can begin to understand the pain of dentistry for your pet. On the day of the procedure, you will bring your pet in early in the morning, usually between 7:45 and 8:15 a.m., but a receptionist will let you know for certain prior to the procedure. When you arrive, you will be greeted by a technician who will take you into an exam room where he or she will obtain very important information from you. Please plan on this taking at least 15 to 20 minutes. We understand you are in a hurry, and we will make every attempt to respect your time, but it is so very important that we take the necessary time to speak with you to obtain all of the most recent information while addressing any concerns you may have before your pet is admitted for their dentistry. It is important that your pet has no food after midnight. While your pet may have water, it is imperative that all family members understand that no food be given, not even treats. We also want to find out what medications your pet may be on and when the last doses of each medication were provided. We also want to answer any questions you have while addressing any expectations you may have for services that will be provided while your pet is under anesthesia. An estimate will have been prepared in advance. These estimates are what we can expect in regular, standard dentistry procedures. Unfortunately, the majority of the overall oral health assessment cannot be determined during your pet's regular checkup, as we can only get a snapshot or quick view at this time. Only once your pet is sedated, his or her mouth evaluated, and x-rays taken, can we begin to get a better idea of the condition of your pet's mouth. If the x-rays reveal the need for surgery or extractions, a technician or doctor will call you with recommendations and an adjusted estimate. That is the reason it will be vital that you schedule the procedure on a day you can be reached by phone. We will need your consent to continue, and it is important to note that no additional treatments or procedures will be done without your participation, understanding, and consent. Rao Animal Hospital believes that you appreciate understanding the care needed and what options are available to you. Even though your veterinarian provided a thorough examination at the time of the recommendation, a staff veterinarian will provide another exam the morning of the procedure. It is important to know that your pet is feeling well enough the day of the procedure to ensure the best outcome. This examination is provided for you free of charge as an additional level of safety. To prepare for the procedure, your pet will be given medication. This intramuscular injection will provide both pain control and sedation, while helping to take away some of the anxiety of being away from you. Rao Animal Hospital knows that you are concerned about anesthetic safety. Our staff is trained in the latest advances in veterinary anesthesia. We also have state-of-the-art monitors that would alert us immediately in any change in your pet's status. When you admit your pet into our hospital, we feel that your pet is now a member of our family. Decisions regarding the treatment of your pet will be the same as if he or she were one of ours. If there are any indications of trouble and we cannot address it and correct it within a reasonable period of time, we will wake your pet up and reschedule under different circumstances. As in people, oral health is vitally important to the entire body. Infection associated with gum inflammation is absorbed into the bloodstream. These bacteria negatively impact the health of vital organs, mainly the liver, kidney, and heart of your pet. Contrary to popular belief, dogs and cats are not supposed to have puppy breath or fishy breath. If you find it unpleasant to be around your pet because of this odor, you can be sure your pet already is experiencing dental-related disease. Visible tartar leads to inflammation of the gums, a disease state known as gingivitis. If we catch the disease process at this point, it is totally reversible. Left untreated, gingivitis will progress to periodontitis, and the support structures of the teeth deteriorate and tooth loss is inevitable. That is why we want to provide this care early, to maintain health. Your veterinarian will guide you as to when dentistry is needed. We perform a thorough examination of the face, throat, lymph nodes, and oral cavity. The teeth are then cleaned utilizing an ultrasonic scaler and hand instrumentation. Once the teeth have been cleaned, we take a full mouth x-ray series. Between 35 to 50% of the disease and infection is hidden below the gums where we can't see it. It is just as important to x-ray the teeth before planning a thorough treatment plan as it is to x-ray a fractured leg to plan what type of repair is required. X-rays show abnormal and unexpected root formation, impacted teeth, fractured roots, and it allows us to evaluate what percentage of bone loss your pet has suffered. We also chart the mouth just like your dentist does for you. This is the process of noting all abnormalities like periodontal pockets, fractured and/or discolored teeth, missing teeth, and crowding teeth. This provides a document of the condition of the mouth today. We can then compare the charts from one year to the next to see what progress you've been able to make with your home care. Our goal is not to provide your pet with a perfect-looking smile, but rather a completely healthy, comfortable, and infection and pain-free mouth. Your veterinarian will then review the mouth, the chart, and the radiographs. With that information in mind, we will amend the estimate that you received at admission. Your original estimate only covered the care required to clean, assess, and radiograph your pet's mouth. Once it is determined that additional work is required, either the dentistry technician or your veterinarian will call you to discuss what treatment you want to provide, and we will amend the estimate to reflect the anticipated care. It is important that you are clear about the level of care you are comfortable and willing to provide at home. Sometimes that information is factored into the recommendations. We want to tailor the recommendations specifically considering the needs of your pet, your budget, and your family. We know and understand how worried you are about your pet. Once your pet is recovered, we will call you again to let you know that he or she is safe and awake, and we will arrange the discharge time. Discharge times are scheduled every half hour based on the time your pet recovered. This allows uninterrupted time for the discharging technician to go over the recommendations for care, follow up, and to answer any questions you may have. It is best to start training your pet to tolerate toothbrushing as early as possible. Rao Animal Hospital provides monthly educational seminars to help you understand and accomplish the recommended care. For dogs, choose your chew toys wisely. There's a lot of misinformation about what is okay to give your dogs, and many of these, although time-honored for many years, can be devastating to their overall health. We strongly recommend you not giving your dogs rocks, sticks, cow hooves, bones, ice, tennis balls, and some very hard toys. Deciduous or baby teeth need to be extracted if the adult teeth are in place. Small dogs require more frequent professional care than larger dogs. For cats, it is just as important to learn to brush your cat's teeth as well. 25% of all cats will develop painful resorptive lesions. For all pets, our pets do not show us their discomfort, but they show us when they are feeling better after care has been provided. Feel free to consult with our dentistry coordinator to choose products that help you maintain the health of your pet's mouth. Some examples are approved dental diets, enzymatic rawhide chews, greenies, and specific water additives. We would like to thank you for taking the time to watch this informative video. If you have any questions about the procedure, feel free to call and discuss this with our dentistry coordinator.